Good afternoon. I'm Teresa Kelly, Executive Director for the Health Council of West Central Florida. Welcome to the fourth session in our webinar series, Eyes on Equity Through the Social Determinants of Health. In this session, we will explore how economic inequities have far-reaching consequences in our communities. Our goal for this series is to stimulate action that leads to systems transformation and ultimately greater health equity and social justice. I would like to thank Baycare Health Systems for their generous support of this initiative, and I also want to thank all of you for being here today and making time to be with us to hear about this important information. During today's session, all participant microphones will be muted. We will be having a panel discussion following the presentations, and I encourage you to submit your questions for the presenters through the Q&A function at the bottom of your screen. The presenters may be responding to your questions as we go along, or we may be saving them for the end. So please use that function. For general comments, please feel free to use the chat function. And in addition, everyone will be receiving a list of resources, the copies of the slides, and a link to a recording of this session in the next few days. Today we have three presenters. Our first speaker will be Dave Sobush. Dave joined the Tampa Bay Partnership in 2015 after previously leading their regional business planning and research efforts from 2010 to 2013. He brings nearly 2 decades of economic development research and project management experience to the partnership. And in his role, he leverages a career worth of project management, data analysis, planning, coordination with outside agencies, and development and implementation of recommendations that enhance prosperity and economic competitiveness throughout the Tampa Bay region. As Business Development Manager for Pinellas County Economic Development, he was responsible for attracting and retaining businesses and the expansion of programs for aviation aerospace, advanced manufacturing, optics and photonics, and information technology industry clusters that resulted in more than 4,500 new and retained high-wage jobs that included a high-profile retention of a Fortune 250 headquarters. He also holds research positions in Hillsborough County, the city of St. Petersburg, and is a faculty member at the University of South Florida's Center for Economic Development Research. Dave is a certified economic developer with an MBA from the University of South Florida and a master's in education and a Bachelor of Arts from the University of Florida. He has been active in the International Economic Development Council, Florida Economic Development Council, and the National Association for Business Economics. He's a proud graduate of Countryside High School and currently lives in Clearwater with his wife and 2 children. Our second presenter will be Doug Griesenauer. Doug is the Director of Workforce Development and Financial Stability Initiatives at the United Way Suncoast. Serving his community at the United Way for the past decade and working in 3 different anti-poverty research centers before that, Doug is committed to ensuring that communities have the best tools at their disposal to help families receive what they need to be successful in whatever they do. With a master's in social work from the Washington University in St. Louis, Doug works to connect national best practices with a local understanding of the communities so that our communities can do their smartest work for their families. And our final presenter, but certainly not last in any sense, is Antonio Byrd, Chief Operating Officer for the Tampa Hillsborough Homeless Initiative. Antonio has served the initiative since August of 2014 and had over 15 years as an abolitionist for eradicating homelessness and generational poverty. He has been instrumental in developing and implementing innovative strategies and initiatives, and he oversees the governance, development, and coordination of the local Continuum of Care network. Previously, he served the city of St. Louis for 8 years as the Contract Compliance Officer and Program Manager for the Homeless Services Division. He was responsible for implementing and co-developing innovative strategies towards decreasing and ending homelessness both locally and regionally. As a St. Louis native, he served as a volunteer on several local organizations and initiatives and was accepted into the Focus St. Louis Leadership Program in 2014. And he has been recognized by the city of St. Louis for his work in leadership and community service efforts. Since arriving in Tampa, Antonio has co-managed the planning and successful launch of the National Operation Revelry, a rapid rehousing initiative for homeless veterans, for which he was invited to the White House in November 2016, and he has provided vision to the county's first community housing solutions center, which houses chronically homeless individuals. Antonio received his bachelor's degree in business management from Harris Stowe University and a master's degree in management and leadership from Webster University in St. Louis. Antonio also enjoys spending time with his wife, Sierra, and 2 daughters. He's into fitness training, snapping photos, and occasionally golfing. And he is a proud member of the Alpha Phi Alpha fraternity. I want to thank all of you for being here today. Mr. Sobush, I am going to turn it over to you.
Well, thank you very much, and thank you for the opportunity to be with you this afternoon. I'm going to kick things off with a little bit of table setting related to some data, but also some perceptions of health equity and equity within Tampa Bay. A lot of this work, much of it, if not all of it, is born out of the State of the Region and Regional Competitiveness Report initiatives that the partnership collaborates within the community. Our partners, the Community Foundation of Tampa Bay, United Way Suncoast, and the USF Muma College of Business. We've been releasing the Regional Competitiveness Report for 4 years now. It is an annual benchmarking report, but the events that culminated in the summer of 2020 with the tragic death of George Floyd and others caused us to take a look and to want to dive deeper. And so we released the 2020 Regional Equity Report, which is a deeper dive into the indicators within the competitiveness report along the lines of race and ethnicity. And we took a particular focus in the equity report to compare and contrast the experiences of Black residents of Tampa Bay with those of white residents of Tampa Bay, as well as our 19 comparison markets. So among some of the health-related indicators that we have in the report, we'll start with health insurance coverage rates. That's the share of people that have either private or public health insurance within a community. And we see that overall, Tampa Bay is underinsured along the lines of health insurance, with nearly 1 in 5 residents in Tampa Bay without health insurance, and that ranks 16th out of the 20 markets. When we take a look at the gap in health insurance coverage rates, Tampa Bay ranks 9th. Some 85% of white residents have health insurance, compared to only 80% of our Black residents within the Tampa Bay region. And we note here that the health insurance coverage rate for white residents is the lowest. It is 20th out of 20 within the comparison markets. Diving deeper into the communities of Tampa Bay, we find that the gap is particularly noticeable within the South Tampa Bay communities, Manatee and Sarasota. And they also have, in addition to the largest gaps, the lowest rates of coverage for Black residents in those South Tampa Bay communities. Poverty is, of course, an imperfect measure of financial instability, but it is one of the determinants of health. And we find that Tampa Bay has a relatively high poverty rate compared to the 20 markets in the report, and equal to the overall U.S. average at 14.1%. When we take a look at the gap is somewhat more pronounced, and the gap between white residents of Tampa Bay and Black residents of Tampa Bay ranks 16th. And we find that Black residents are nearly 2.5 times more likely to live in poverty versus white residents. And again, within the communities of Tampa Bay, we find that Sarasota has the largest equity gap in terms of the poverty rate, where Black residents are 3 times as likely to be living in poverty compared to white residents of Sarasota County. Digital access is a relatively new indicator in the competitiveness report. It talks about the share of households that have access to both a computer and a dedicated broadband connection. So using a tablet or a cell phone on a cellular network does not qualify as digital access. we find that among the comparison markets, Tampa Bay ranks last in terms of digital access, with only 82.5% of our households having that computer and dedicated broadband. Digital access is important not just for e-learning, as so many households found out during the pandemic, but also for access to employment opportunities and increasingly access to telehealth and telemedicine. The gap in Tampa Bay is, also pronounced relative to the markets. It's the third largest gap, and Tampa Bay ranks 18th in terms of the difference between white household digital access and Black household digital access. And we note here that both Black and white households in Tampa Bay rank lowest among their respective racial groups across the comparison communities. Within the communities of Tampa Bay, we see that, despite a relatively, dense population and what, a rather mature infrastructure, Pinellas County, it was somewhat surprising that Pinellas County had the second largest gap in digital access when examining the effect of white households and Black households. I want to pause and just talk a little bit about the pandemic, the most critical days of the health crisis we hope are behind us, and we hope that brighter days are ahead for all in the economy. What is shown here, and it's a large reason why things have begun to open up, and despite the fact that I'm very happy to be here, I hope this is the last Zoom panel that I'm on. What we're showing here is we're showing the overall numbers of vaccinated residents within the Tampa Bay region. Those are the blue bars, and this runs from the first vaccinations in January to the beginning of midpoint of June, rather. And we see that, roughly 1.75 million residents had received, their vaccination sequence. But we notice, and this has certainly been borne out by a lot of the more recent data, that the number of people receiving either their first shots or completing their vaccination sequence, it peaked, in the middle part of April, and was on a precipitous decline from the middle of April to the middle of June. Meaning that those blue bars are not going to get much higher than the 1.75, maybe up to as many as 2 million folks receiving their vaccination sequence. And we compare this, to some information that we gathered through a survey, our State of the Region survey that was conducted right around the time where vaccines were becoming rather prevalent. So it was very end of March, beginning of April. And what we found when we took a look along the lines of race and ethnicity is that we found among African-American residents of Tampa Bay, while they were very more likely to be concerned about the COVID-19 situation, they were also less likely to get vaccinated. And similarly, for residents of Hispanic ethnicity, they were much more likely to be concerned about the COVID-19 situation and less likely at that time to have received a vaccination. So, while the interest and the antenna are up on the perils of the pandemic and the health impacts of it, there is some reluctance and reticence against receiving the vaccination. And this is borne out, this was some of the latest data we were able to gather at the beginning of June. We see a sharp difference between the vaccination rates among white residents and Black residents within the communities of Tampa Bay. We find that in Tampa Bay, some of the 8 counties at the time of this, nearly half of our white residents had received at least 1 dose of the vaccine, compared to slightly more than a quarter of Black residents having received 1 dose of the vaccine. The COVID-19 is not the only health crisis facing this community. For several years, we have had, a significant issue related to opioids. And, this table here talks specifically about opioid overdose death rates between 2014 and 2018. It's some of the latest data available. And while the overall prevalence of opioid overdoses are low among Black non-Hispanics, we note that they had the largest percentage increase at 330% over that time period, 2014 to 2018. And one other way to sort of ultimately take a look at the health of a population is life expectancy at birth. And so what this map shows is state by state a examination of life expectancy at birth. We see that Florida ranks, there's only one dark red, that's Mississippi. There's only one dark blue, and that's Hawaii. And Florida is in that, somewhere between 60 and 80 centile of the quintiles here. But when we dive deeper into the state of Florida, we see that, not all of it is that nice light blue. And in fact, there are, pockets of deep red and deep blue. And then focusing in more closely on Pinellas and Hillsborough counties, we see some, as a researcher that's taken a look at equity along the lines of race and ethnicity in transportation and in education and other areas, this is a very familiar pattern to me because it looks almost identical to the concentration of schools within Pinellas and Hillsborough County that have less than 33% of their kindergartners ready to learn and less than 33% of their third graders reading at grade level. The map looks very similar to the share of the concentration of households that have either high poverty or low vehicle access in terms of the number of vehicles available to that household. And it reflects, very closely, sort of this, economic mobility, which is what is the chance that a child born into a low-income household could become a high-income household by the time they are 35. And ultimately, it looks very similar to, the map of our, communities of Blacks and Hispanics within Tampa Bay. And once again, it is it's a repeatable. It's not, unfortunately, it's not very surprising. As sad as it may be, it is prevalent across many lines, whether it be life expectancy, education, availability of transportation, and ultimately upward economic mobility. I want to just close with a little bit of our survey work that we did specifically to racial sentiment within the Tampa Bay region. This was a online survey that was conducted with 450 residents, not of the 8 counties, but of a 4-county area between October 2nd and 5th of 2020. We did oversample Black and African-American residents of Tampa Bay just to make sure that we had enough data points to do a crosstab of Black residents of Tampa Bay. And when we present the overall results, we weight those oversampled responses so that we can provide a accurate representation for gender, race, and age within the overall Tampa Bay population. Some top line results that we found in this were that Black residents much more likely to view issues of race and racial discrimination as pervasive and systemic, whereas white residents were, much more situationally dependent. It was not something that the white residents, would ascribe to systemic or pervasive issues. We also found that, across all races and ethnicities, Tampa Bay residents largely in agreement that Black people are treated less fairly than white people when dealing with the police or criminal justice system. And, an area where there was a divergent opinion, and, there was, this was in the heat of the political season. We were a month away from the election at this point. We found in a divergent sense that white residents believed that it had become less acceptable for people to express racist or racially insensitive views, whereas Black residents believed that it had become more acceptable to express those views. So, this is, the data slide that sort of speaks to that situational versus pervasive or systemic. We see that, there is, quite a bit of difference between, Blacks and whites in terms of whether or not there is systemic or institutional racism. A little more agreement when, folks saw about individual racial discrimination, right? So not systemic, not pervasive, not institutional, but much more individual. But then we see some real divergence in the opinions of Black residents, white residents when it comes to things like access to high-paying jobs or access to schools. And then, that was sort of, what's the diagnosis? What's the problem? Here's some of the, prescriptions. So we put forth a menu of options. What would people feel would be, ways to reduce racism and racial discrimination? And when it came to things like creating more financing and procurement opportunities for Black business owners, or implementing policies to increase racial integration in public schools, there was slightly more agreement. But, in terms of redirecting funding from the police to education and other community services, or the issue of financial reparations for those historic wrongs, including slavery and discrimination, much more divergence between Black residents and white residents within the Tampa Bay community. So I want to thank you for allowing me the privilege of sharing a little bit of this table setting. I'm really looking forward to hearing from both Doug and Antonio. I'll do my best to answer any questions regarding this data in the Q&A, and look forward to joining my panelists at the end for what I hope will be a pretty robust discussion. Thank you.
So Doug, we're ready for you.
Excellent. So going on next, I just want to reiterate that if anyone does, as I'm talking, have any questions about either what I'm discussing or what David just discussed, please feel free to use the Q&A and throw those questions out. We'd love to be able to answer them and work with you all there. So my name is Doug Griesenauer, as mentioned, and I'm with United Way Suncoast. I'm here to share with you our ALICE report for Eyes on Equity. Real quick, Teresa, are you able, let me share my screen real quick. And then Teresa, if you could confirm once we're able to see my PowerPoint to make sure that everything is running smoothly.
Yes.
Teresa, are we able to see the PowerPoint for everyone?
Yes, I can see it. Thank you.
Excellent.
Yeah.
So my name is Doug Griesenauer with United Way, and Dave Sobush in his presentation gave a lot of fairly sobering data about the state of our community. Unfortunately, I will not be the one to raise our spirits as I talk about some more sobering data through our information, specifically around individuals in our community who are not doing well, and more specifically, how many people in our community are really struggling. Dave mentioned in his presentation that they track poverty, and they've noticed there's a huge discrepancy in equity in relates to poverty rates, but poverty itself is an imperfect measure. And so to give you all some perspective on that, I want to let you know what ALICE is as an alternative to that. Because the poverty line itself, if anyone's not familiar, is a fairly broken tool. Some history, it was actually created back in the 1960s by a very, very good researcher by the name of Dr. Molly Orshansky. She was tasked by her superiors to develop a plan of the number of people in her community who are not doing well. From that, based on the information she had available to her, which was 1955 USDA Department of Agriculture data, there was high, medium, and low food plans that our communities had in terms of the cost of goods in 1955. She took that low basket of goods, and at that time, people spent about 1/3 of their income on that basket. So she took it, multiplied it by 3, and called it the federal poverty line, and said that was the line that people needed to be at in order to be okay in our community. That is the federal poverty line that we use for 2021. Adjusted for inflation, of course, but that is still the baseline and the metrics that we use as we're doing this work. What's very fascinating is actually, I was giving this presentation a few years back, and someone raised their hand at this point, which very rarely happens, but I was bold, so I called on them. And they mentioned they actually had interviewed Dr. Orshansky, which was fascinating to me. And they said that everything about this information was correct, except for one thing. And what they said was that back in the 1950s, there actually were 4 costs of goods in America: a high, medium, low, and a crisis level basket of goods. This crisis level is bare bones amounts of goods for individuals who've just lost their job, just lost a loved one, just experienced a major crisis. And Dr. Oshansky said people shouldn't live their entire lives in crisis. And so she used the higher up marker. When she brought it to her superiors, they said that if they used that higher marker, too many people would be in poverty. And so they actually brought it down. And that crisis marker is actually what we use for the federal poverty line. Back in the 60s, they knew that there already were more people struggling than what the federal poverty line uses. And that is still true today. But what changes in respect to that? How do we adjust and make sure that we're actually measuring the right stuff to know how we're doing in our community? Well, with that, there was what's known as the ALICE report. It's a dollar threshold that recalculates how much it actually costs to get by. It's an acronym that stands for individuals who are asset limited, income constrained, and employed. But I assure you, those are just 3 common aspects of an individual in ALICE. They do not denote and define an individual in ALICE. And this is important. All individuals who are below this range that I'm going to talk about for these dollars count. They don't have to be employed. It's just a topic that they use to describe ALICE. All of this is available at unitedforalice.org. Please feel free to write that down and share alike with this information. And so from this information, we see that looking at poverty, even with that broken tool, there's about 13% of Floridians who are still below that measurement, which is a shame. But then there's another 33% of individuals that are in between this range of being above poverty, but still below that ALICE threshold, meaning about 54% of individuals in Florida are doing okay. Again, 54% of people are doing okay, and everyone else is struggling with something or other based on their budgets. And so what are actually the costs that we're talking about here? Well, what they do is they broke it down by 7 different categories: housing, childcare, food, transportation, healthcare, some miscellaneous costs, and taxes. So instead of just looking at that basket of goods, they broke it down by these 7 different measurements. And we're talking about these things. When we're looking at housing, it is below average size and cost, including utilities. When we're looking at childcare, it is the cheapest legal-based childcare available. And to throw some of these numbers at you, this is a chart. Feel free not to absorb it all right now. We're going to be sharing these slides with you later. But if you look at this chart right now, just train your eyes to the 2 adults and 2 kids in childcare range. And you go down to that second marker of childcare. It lists out that 2 adults and 2 kids in childcare in Florida cost $1,162. What's interesting is that that is ridiculously low. I have a child, I have 2 children in childcare. I have a 4-year-old and a daughter that turned 1 yesterday. We had a birthday. It was great. She's adorable. But when we were looking for childcare for her, I assure you, we did not pay these rates because you can't find quality childcare that would be able to fit these markers. And what's even more frightening is that the ALICE data doesn't just look at statewide data. We can break it down by counties. And so it's 1162 in Florida. But if you look at our county area, so United Way's 5 county areas, Hillsborough, Pinellas, Manatee, Sarasota, and DeSoto, it's even more expensive. And again, all of these costs are bare bones costs, but when you add them up, it actually costs about $74,000 to get by in our community. That's a lot of money, but it's still what people need in order to get by. And it still shows that there's a vast number of individuals that struggle in our community. People have told me never use giant charts in presentations. Instead, you should use pretty graphs. So this is a pretty graph version of the data that I just talked to you about. And what it shows you is fairly jarring, that the federal poverty line for a family of 4 doesn't even cover housing and childcare costs in real time for an actual family of 4. It's the reality of what we're living in right now. So as you looked, the keen observer of some of these graphs would have noticed that all this data I was presenting to you was actually a little delayed. It was 2018 data because they use census clean data, and there's always a few years delay on that. And so all of this needs to be seen as things were improving. I will tell you that there is an inequity that we're having to address, but all of this has to be looked at through the eyes of all of this was before the pandemic. All of this was before COVID. So let's talk about what the pandemic did to this struggling individuals that we see in our community. Well, if we look at our unemployment rates, that's one way that individuals track how we're doing. And you'll see that we had a giant spike in April of 2020. You may recall a disease came around called COVID, and it led us to 14.7% unemployment. literally Great Depression style levels of unemployment. And of course, that giant peak dropped down a little, but we're nowhere near the unemployment rates that we were before this started. And I also want you all to look at this little spike that looks like a little spike on this graph. This little spike were months of individuals in our community who did not have money to get by. Typically, the story for Alice is they're always one paycheck away from disaster. And they had many missed paychecks in 2020. And because of that, many individuals are still facing disaster, even after the pandemic is quote unquote fixed, on the upswing, whatever you've been hearing, right? Things are improving, and that is true. But the recovery that our individuals are facing is fast. Another thing I want to share real quickly also is the labor force participation rate did plummet and has not recovered. These are the number of individuals who are actually in the workforce, and that has dropped down. A fun note to point out is that these aren't individuals who are unemployed and receiving unemployment benefits, because you need to actually be categorized as looking for work to be unemployed in these categories. These individuals here are just out of the system. And so what does that mean for our families? Well, Antonio is the expert here on homelessness, so I'll be very quick on this, but the census does a housing pulse survey and asks individuals how they're feeling. And for renters, we ask them the likelihood of leaving this home due to an eviction in the next 2 months. And for renters, more than half expect to be evicted in the next 2 months. For homeowners, that's also 1 out of 5 of all homeowners believe they're going to be foreclosed upon. It's either very or somewhat likely, which is difficult to see for even individuals who own their homes. And this is something that always strikes me, is 1 out of 4 of all renters in Florida have little confidence to pay next month's rent. And there's 9% that have no confidence at all. So when people talk about the ability to recover, we see that it's not created equally in our communities. And there are lots of people who are struggling. And so when we're looking at how we're doing in our community, and a lot of people are looking to back then, 2020 as the pandemic, we need to be aware that this impact in our community will be years of recovery. And we need to keep that in mind as we're building our actions to our communities. So really, when we're looking at this ability, we want to dive deeper. And so I'm going to go pretty quick through these charts and graphs. And I have all these here because you'll get this presentation later. And so I want to have these charts for you to be able to reference. So I will drive through these. If you aren't able to see this data, don't worry. It's okay. You'll get a reference to it. But I want to show that ALICE rates, again, this is back from 2018. Locally, poverty was actually slowly getting down, and ALICE rates were slowly improving. But to give you all context, 31% of our households that are in ALICE is still over 400,000 households of individuals who are struggling. When we look across our communities, we see that all areas of Florida need support, but rural Florida has the greatest individuals below ALICE. But that being said, there are many zip codes of individuals who are struggling. If you look to that chart to the right and you see individuals who are more likely to be in ALICE, and you hearken back to Dave's many presentations on his graphs on individuals who are struggling, you see that this ALICE data mirrors what Dave was showing as well. And so again, we see this layering of difficulties for a lot of individuals in our communities. But not all individuals have been able to benefit equally from our communities. And so if we look at family household types, what's interesting is that families with children are more likely to be in poverty, but actually single adults also struggle through ALICE rates, which shows that single adults, families with children, and seniors all are struggling to get by in our communities. When we look at those families with children, though, you do see that single female and single male headed households are much more likely to be in poverty and more likely to be in ALICE. Of course, there are many different household types in our communities, and the census breaks it down only by 3, and we're limited by the data they have to us, unfortunately. But we see that married households are more likely to be above ALICE, single family households are more likely to be below, understandably so. But I want to actually look at the very right of this graph, where we see that single male and single female headed households in our local area, about 37% of all families with children are single parent households. That's a lot of people. And so when we're looking at the individuals who are struggling, it's not just a small group of other. It is a lot of the populations in the communities that we work with every day who are struggling. We look at households by age. We see households that are under 25, the head of household being under 25, much more likely to be in poverty and ALICE. But if you look at the very right, that's actually a very low percentage of total households that are under 25 if you're the head of household. Seniors, though, also do struggle with this ALICE rate. America has a fairly robust safety net for seniors to keep them out of poverty, but that net does not extend up through the ALICE thresholds. And now where we're having these conversations is this conversation on race and ethnicity. What we see is Black and Hispanic households also struggle in getting above ALICE, as we see the parallels through poverty rates. Now, Dave has talked a lot about this work, and I don't want to echo his work, what he's talking about, because he said some fantastic things, and I don't just want to say the same thing, because I can't say it better than him. But what I do want to share with you is that when we look at these rates, there's a lot of questions on why. And I want to just give you one slide to help get a better feel for why we have these difficulties. And that the fact is that looking at this pandemic recovery, it was not treated equally across our community. This was the same unemployment graph that I showed you before, but instead of just looking at unemployment in general, we broke it down by sex and by race, looking just at white men, Black men, white women, Black women. And what we see here is there's still that spike that happened in April. That Great Depression level spike still happened across the board to everyone, right? COVID impacted everyone. That's a fact. But the recovery from it has been vastly different by different parts of our communities. If you look at it, and again, this data is as of May of 2021, but it hasn't really improved that much in the past 2 months. We noticed that Black households have not recovered from COVID as much as white counterparts. With the May Black male unemployment rate is only 2.5 percentage points lower than the peak of white male unemployment. That peak Great Depression era level unemployment that everyone said was historic and was. Everyone also said we recovered from it. And if you look, breaking it down by specific populations, we know that not to be true. And so when we're talking about how we build out our work and how we understand our equity, we need to realize that recovery is not something that's happened equally across our community. And therefore, it's something that we need to be looking at and addressing as we do our work. And ultimately, what I want to look at really quickly is how do we respond? Because I do want this to be more than just presentation of depressing information. And that's what this is, right? A lot of information that is sobering. But what we know is that there is action that can take place on it. And what we can do is we continue to do in each and every one of our individual work. Each and every one of you has a different network, a different responsibility, and a different way that you access your community. And I would encourage you to use those strengths to continue to support households that are hit hardest by this pandemic. Understanding inequity is one thing. Acting to address it is an entirely other and much harder beast. I'm very honest with the fact that between the two of us, I have the easy job of presenting the information. Having to work on it is a much harder beast, but it's something we need to do. But as we're doing that, we also need to continue to reinforce our efforts around supporting education, financial stability, and other benchmark measures in our community. But on top of all of that, we also need to just advocate. Let people know that this is the truth of our communities and these are the realities that we're facing. Because with that advocacy, understanding where we're doing and how our community can get better is where the real strength lies, right? We've been looking at these charts and they are sobering, but also they're difficult year over year. And we can do something about that to address it. And so that's where I would have a call to action for us to be able to not just absorb this data, give yourself a moment to see it, to look at it, to reflect on it, because obviously it takes some time to fill in, but don't have your knowledge and your work end there. I really encourage us all to expand and to address every single one of us has a role to play in our community and how can we use this data to move forward. And so again, with that, I'll end my presentation and bring it to the star of our show, Antonio Byrd, who will bring us home with some very good information. Thank you very much.
Good afternoon, everyone. Thank you to Dave and Doug for presenting the information that they presented. And so one of the things that I'm just going to organically do is just kind of bring all of this information home as it relates to the inequitable economic determinants of health, but particularly giving you the idea of how it is associated with homelessness in general. And so my presentation will, in some cases, kind of bring you on the tail end of the roller coaster, in that you've been coming on this down drop of the roller coaster. And so I'm going to bring it down a little further, but then bring you up on the upswing to tell you some of the things that we're doing in the community in relation to addressing homelessness, but more particularly talk a little bit about what it looks like when, as a country, we can effectively address the social determinants and make sure that the quality of life is increased for everyone. And so you should be able to see my presentation. And again, I'm Antonio Byrd. I'm the Chief Operating Officer of the Tampa Hillsborough Homeless Initiative. For short, THHI is the Continuum of Care Lead Agency responsible for the strategic planning, community coordination and collaboration, as well as the homeless database facilitating of the homeless Continuum of Care network. And so a continuum of care is basically a footprint. So our footprint is Tampa Hillsborough County, and every individual, citizen, business, stakeholder within that footprint is a part of the continuum of care. And so we are your continuum of care lead agency. So what economic social factors contribute to homelessness? Some of the information that I'll speak about, again, you've already heard about these things in the other two presentations. And so what I'll do is try to not regurgitate information that you've already heard, especially since these slides will be shared with you. But I want to hit home more on the items that you haven't heard of already, or that you may not think contribute to homelessness. And so the United States, as of 2021, is ranked the 7th wealthiest country in the world based on the GPD. And so although we're the 7th wealthiest country in the world, we have this illness that we continue to live in relationship with, which is the issue of homelessness. But homelessness is not a singular issue. It is very complex, in that there are other causes that creates the issue of homelessness. And so I'm going to talk a little bit about, in addition to poverty, the lack of education, access, and quality, unemployment, and what I like to call underemployment in terms of low wages. We hear a lot of presidents speak about the number of jobs that have been increased under their presidency, but the one thing that is not necessarily factored in is the number of jobs that a single individual has to hold in order to survive and sustain their living arrangements. The lack of affordable housing, barriers to healthcare, the way in which individuals cycle through the criminal justice system, in particularly how mental health and physical health play into individuals experiencing homelessness, and last but not least, addictions in terms of substance abuse, and how homelessness can exacerbate these particular issues. And so we like to say that housing is healthcare, that although our country doesn't like to look at healthcare from a social economic perspective, which is why it's really, really difficult to approve healthcare for all, for example. And I'm not talking political in the way that rather they want to look at it as the term they use is social impacting, or from a point of right-wing talking points. I'm talking that housing is healthcare, and in order for people to be able to live healthy, they have to have housing and also access to appropriate healthcare. And so when we talk about neighborhood and built environments, this is really along the lines of the lack of safety, the use, being able to acquire tax dollars in order to increase the quality of life for the residents that live in a particular community. And most of the communities that are impacted by the lack of tax dollars, I'm speaking to mostly communities of color. Parks and playground A lot of times you may see basketball hoops, but there's no rim, or the playgrounds are dilapidated where the equipment doesn't work, and haven't had any upkeep. Adequate transportation, workforce opportunities within that community, and healthcare resources. Now, I would say Hillsborough County does a really great job through like Tampa Family Healthcare Center and Hillsborough County Healthcare Plan to try to provide access to healthcare resources, right? But we're speaking along the terms of this from a regional, state, and federal level, not just within our community, and how it plays an important part to individuals living a sustainable and healthy life. And just to give you a little bit of context of this particular issue, when I was growing up and when I was younger, and I'm speaking like when I was like maybe 5 or 6 years old, I lived in a condition where the community wasn't safe, it lacked safety, there wasn't any tax dollars that came into the community to increase the quality of the buildings that we lived in, so much so to where you could like see the neighbors downstairs through the holes that were in the floors. And this wasn't because the property owner wasn't putting money back into the property. It's just that the units themselves had went so long without being repaired that the property owners at times they lose the momentum of keeping the upkeep of the properties under control, and therefore it gets too far away to where they're not getting enough resources coming in order to increase the quality and the decency and safety of those properties. And we didn't have any parks in the neighborhood that we could play in. And so what you end up finding is that kids generally tend to look to other, I will call them extracurricular activities that doesn't increase their quality of life, and it doesn't ensure that that the neighborhood in which they live in can be sustainable at a higher level. And so the next thing I'm talking about is access to education and quality education. Most communities, as you know, generally have a public school entity within their communities. But when you look at the quality of the education of the public school system, and a lot of times we like to look at this from a school grade, it is not because the school lacks talented teachers and or administrators and principals. It's because the resources that those teachers and administrators need in order to adequately educate the students that are attending those schools aren't being provided to them. And in fact, a lot of times you may have known that resources generally get pulled and constantly get pulled away from the public school system. And so it opened up this door for people to begin to market begin to market private educational opportunities like charter schools and voucher holding type of schools. And we wouldn't have to do that if the necessary resources are actually put into the education system. And so when we talk about literacy, language, and early childhood education, these things are really, really important. I believe it was Doug that talked about how important it was for students to learn how to read before they enter into 3rd grade. And so if a student has issues with reading and there aren't resources in the school system to make sure that that student can get the appropriate help that they need to increase their competency and comprehension skills, then of course, they're gonna struggle in their educational endeavors. And so, and another key thing, and I will speak more to the way that things happen as I was growing up, is that in Black communities, we speak what is called slang. We have a certain type of dialect in the way in which we speak. And so when you go into an educational setting, they may look at that as an impediment in that you don't know how to read or you lack comprehension, and therefore they would move you into certain educational components that may not be to your benefit, such as they'll put you in special education, which at times are educating the students at a much lower level, and that can also prevent an individual from learning at the correct level that they need to learn at. Case in point, that was something that they attempted to do with me because of the way in which I spoke. They felt that I needed to be in special education, but because I had individuals in the community that were advocating against that for me, and including my parents, I didn't have to go through that particular route. But a lot of the individuals I was in school with were passed through the special education process, and therefore it did impair their educational abilities in terms of being able to go on and, compete at a higher level. And so a lot of the kids that are experiencing homeless, they already lack the stability and the support that they need in order to succeed academically. And when they're actually experiencing homelessness, not having access to transportation, not even having an address to put down in order to properly attend school, can impair their academic success. Another thing that they put into play back in 2001, or what I would say where they began to strongly enforce it, was truancy. And so not only are the parents dealing with the fact that they don't have a stable place to live, and they may be living on the streets or in shelters, they have to deal with the school system and the court system coming after them because of the number of days that a student may have to miss school, because the population is very transient. They have to keep moving, and you may not find a shelter bed one night, then you got to find somewhere to live and lay your head at, for that particular night when you can't find somewhere to sleep. So that is kind of the cycle that happens, that when you have a family that is already living in a poverty-ridden community or neighborhood, and they don't lack the resources in order to sustain that, they end up in the situation of homelessness, which impairs their children from getting the proper education that they need, on top of the things that the school system may already be dealing with. So then we say, okay, does money actually fix the problem? In some cases it can, but just because, again, I mentioned that a person has a job doesn't mean that they are making enough to take care of their basic needs. We're talking Maslow's hierarchy of need. And so a lot of times we like to move away from those things, but those things still reign true today, no matter how much money an individual makes, is that if you don't make enough money to take care of your basic needs, I'm not even talking wants at this point, it can have a huge impact in terms of the quality of life that you can experience. And so when you're living in a neighborhood that the most of the residents lack economic stability, then it can have a huge impact. And so when you're talking about 7 out of every 10,000 people in the United States that are experiencing homeless on a single night, many of them are experiencing homelessness because they can't afford things like healthy foods, healthcare, and housing. Which leads me to the big one. We're talking poor physical and mental health, right? It reduces a person's ability to not only find employment and earn adequate income, but it also has an impact on their ability to sustain their housing placement. Because if you're in and out of the hospital, or if a person has to go into a hospital for a long period of time, especially like during the COVID pandemic, you go into the hospital and you have to be there for more than 30 days, and you're not able to have someone take care of your housing responsibilities, then that can cause an individual to experience homelessness. To that point, when you have to go in and out of healthcare, or individuals that are experiencing homelessness, a lot of times they're using the emergency room as their primary healthcare resource, which is extremely costly, not even for the person that is going to the ER, but for the community. So we like to say, who is actually fronting that bill? Who pays for that? And so since individuals that are experiencing homelessness, we're talking over 500,000 people in our country, most of them use the emergency room as their primary healthcare resource, and we're already fronting the bill as taxpayers. Why not provide healthcare for everyone in order to make sure that the cost of healthcare is fair for everyone. Fair doesn't always mean equal, but it just means that a lot of the individuals that are paying taxes and already have health insurance, we're the ones, or you're the ones that are fronting that bill. And that's the reason why you see the healthcare rates for people that have private or healthcare through their employer, those rates go up. And so people who are homeless have a higher rate of illness and die on average 12 years sooner than the general population. And so in order to make sure that you have an adequate place to live and that most of your basic needs can be taken care of to a degree to which it would prevent you from becoming homelessness, and identifying the necessary resources in order to address your healthcare needs, it takes a social and community surrounding in order to support those things. And so people that are experiencing homelessness have a really hard time being able to partake in that community support in terms of family. A lot of times they burn their bridges with their families, churches, social groups, community groups, school friends, and community friends. Those things are few and far in between. And because of that, they weather a lot of the threats in terms of losing, being able to not only lose their housing, but actually access housing, income, deal with addictions and family breakdowns. So most of them go without the community support in order to regain their housing stability and live a much longer life. And so we can't really talk about housing in healthcare without talking about disparities. And one of the biggest things is that, and I'm speaking more particularly to racial disparities in our country, and most minority groups in the United States experience homelessness and healthcare disparities at a much higher rate than whites. And again, Dave and Doug have shared graphs and data to support this particular statement and giving you a visual context of what that looks like at a much higher degree nationally. And so when we're talking about racial disparities, a lot of this is driven by bias and prejudice. And sometimes it can be unconscious bias or prejudice, especially in our healthcare system. When you're talking about infant mortality rates within the healthcare system among African-American women, in particularly, is at a much higher rate than white counterparts. I'm talking overt discrimination and systematic and institutional racism. Going back to the health and healthcare and housing living arrangements that people experience in communities of color, where those communities are actually built by design. Those things aren't something that they choose and say, okay, we are going to go live in this particular part of the county and or city. You have what is called gentrification and redlining that takes place that produces these unhealthy and or overly populated communities of individuals, not even, even though most of them are people of color, but it's just people that are really, really at the extreme level of low income and poverty within our community. And so to put it in context in terms of homelessness, how does racial disparities play within the issue of homelessness? Most minority groups experiencing homelessness is experiencing at least 50%, if not more than 50%, than their white counterparts. And so when you're looking at it on the national level, I mean, the African-American and or minority group make up roughly, like I said, 48% of the population. And so when you're talking about the number of people experiencing homelessness, about 10,000 in population, per 10,000 in population by race and ethnicity, you see Blacks at 55.2, and you see that whites are experiencing it at 11.5 per 10,000. But African Americans only make up a smaller percentage of the general population. And so when you look at the homeless population versus the national population, you see this percentage is much, much smaller. Less than 25% is made up of African Americans, but African Americans make up almost 50% of the homeless population on a national level. And then breaking it down by ethnicity, Hispanics versus non-Hispanics versus the US population. And now I'm gonna take you on the state level. So when you're looking at it on the state level, you see that African Americans make up 37% of the homeless population, and whites make up 58%. But you say, oh, that's good, but African Americans only make up 17% of the state population, general population, and whites make up 77% of the general population. And now we're gonna bring it to my community, Hillsborough County. And so, and if you do this for any community across the country, these numbers are almost gonna be parallel to some degree. In that when you're looking at the general population of Hillsborough County, African Americans make up 18% of the county population of 1.9 million people, and whites make up 75%. However, African Americans make up 48% of the homeless populations versus 49% of whites. And then you're looking at 17% Hispanic versus 83% of non-Hispanic of the homeless population versus 29 and 71 of the general population. And this is actually a slide I added in as Dave was talking, because the interesting thing about it is that when he was showing his maps, those maps are exactly parallel to the map that we have for people that are actually living on the streets. This map was produced by engagement with individuals in encampments and on the streets. And it's a spit image of it. And when you look at it by zip codes. And so when we talk about housing as healthcare, it's really difficult for individuals experiencing homelessness to actually have access to decent, safe, and affordable housing. When you look at the federal government, particularly HUD, the U.S. Department of Housing and Urban Development, fair market rates, these are the rates that they say that they're willing to support, and or that the funding that they supply to communities are able to cover. You look at the 2021 number, and the efficiency is at $989. That's at fair market rate. And let's be a little more realistic. When you're talking about a 1-bedroom, it's at $1,040, and a 4-bedroom is over $2,000. I know individuals, that are paying, almost the price, the fair market rate of a 3-bedroom, which is $1,600. They're paying that, for a 1-bedroom in Hillsborough County at market rate. Because in order for these numbers to work, the property owner would have to agree to accept the rent at this amount. And this is mostly even among those that are receiving housing vouchers through the continuum of care, through the housing authority. These are the numbers that they have to work with, and that those vouchers cannot go over these amounts to some degree. And so if a landlord has a 3-bedroom and they're charging $2,500 for that 3-bedroom, they have to be persuaded to take this $1,600 for that particular voucher. And so how do we address race, the disparities among, among races? We can address it as you've seen today throughout all 3 of our presentations, that we have the data to support the context in which we're speaking to you from, but it takes utilizing that data in order to create the necessary policies in order to change the way in which individuals are provided services and have access to services, have access to housing, have access to healthcare, And so some of the ways in which that this looks is that I like to share my, a lot of times when I speak, I like to share my personal story because I went through the foster care system for a couple of years, starting at the age of 8, and then lived in poverty in communities that were not, the safest, and or in buildings, as I mentioned, that were not the safest, as well as experiencing homelessness at 17 years old and until my adulthood, from 17, roughly around 22, 23. And a lot of times when people say, okay, how did you get to where you're at in life? I got to where I'm at because through the circles in which I was partaking in and some of the friends that I was able to foster, and a lot of the teachers and whatnot that invested in me, I was able to get to where I was at. As I mentioned, having advocates. And sometimes they were not family members. These were just people in the neighborhood or folks that knew me, that advocated on my behalf, especially like I spoke at a national conference for attorneys. And one of the biggest things that we talked about was the power of the term attorney. And so when you're an attorney, you can help a youth get emancipated, and or you can help a youth get what they call FAFSA, which is federal grant resources through the educational system without having to utilize the taxes of their parents, because they may not be in relationship with their parents. And so those are the power of being an advocate for someone that is, or particularly even a youth or a family that's experiencing homelessness. There are a lot of families that are that can't even be reunified through the foster care system, is because they can't find an affordable place to live, even if they had a voucher in hand. So that's prevented that family from being reunified when they cannot find adequate housing to live in order for their families to be unified. And so in Hillsborough County, we've come up with what we call the 560 and 560 strategic plan on homelessness. It's to house 560 people in 560 days, basically those that are living on the streets, and providing them with the necessary resources to decrease their barriers to shelter and housing, so that they can begin to address their basic needs. And so we talk about housing first. Old school way of doing business is that a person has to be clean and sober, and they have to earn their right to housing in order to get a voucher or in order to get services. We believe in housing first. Put them in housing first. Then you can then begin to address the healthcare needs in terms of mental health or substance abuse needs. You can then connect them to unemployment. You can connect them to unemployment resources or employment resources, right? Is that when a person's shelter, meaning housing, is addressed first, basic needs are addressed, then they can concentrate and have the focus in order to address their other needs. And so that includes, criminal backgrounds and or evictions as well. And so I'll yield my time, or my time is up actually, so that we can answer any questions or comments the participants may have. Again, thank you so much for allowing me to participate in this event, and I've enjoyed presenting this information to you.
Thank you so much, all three of you, for your presentations. I had no doubts that they would flow just so organically together, and that's why we asked you to do this in the first place. So we're going to kind of switch our format a little bit here at the moment, and we have just about 20 minutes left. I've prepared a couple of questions for you guys to get started with. And I do see that we have some questions in the chat as well. But I want to get started. And you've already talked a little bit about what can be done. But now that you've shown us the data with respect to equity, economics, poverty, what can be done to improve these outcomes?
I'll
I can
jump in.
start.
Oh, go ahead. No, after you. Oh, I don't know which way you are
Okay.
on everybody's screen. Go ahead, Antonio.
Yeah, it probably looks different for everybody. So I'll jump in really quick and say that one of the key things, and this doesn't even cost any money or anything, is to educate yourself on these particular issues and be involved with your local continuum of care and the partners that are involved. And so all three of our organizations are part of the continuum of, all of our organizations are part of the continuum of care. And so just because you're not part of an organization, you can still participate in the workings of a continuum of care. We just had national or the state advocacy day that was about a week and a half ago, where it was done virtually, which was different, but we were able to talk to our state representatives and national representatives at the White House to advocate for more affordable housing, healthcare for all, those types of things. And so just being involved is really, really key.
Dave.
Yeah, thank you. And, I'd add to that, I mentioned in our competitiveness report, we've got some great partners in United Way and the Community Foundation of Tampa Bay, as well as a lot of stakeholders in the community that help make sure that we're delivering meaningful content. But the work that USF Muma College of Business does, it's through their Center for Creative Analytics, and they do a big data exercise that takes a look at all 20 of the communities. That looks over, a couple decades of data and really does some deep statistical analysis to understand, if we move the lever on some of these indicators, how do we change the outcomes we want? And in particular, it's been well established that, poverty is an inadequate measure of financial instability. But what the work of the big data team at USF found is that by primarily, a not necessarily easy, but simple way to reduce poverty and at the same time increase gross domestic product is to increase the availability of transit to individuals. And this area, suffers from a relative lack of transit. We rank 20th in the supply of transit, relative to the other markets. And when you think about it, especially as, poverty has branched, from, very, very central locations into, high rates of suburban poverty, many of our health facilities that, provide care, to lower income individuals are still more centrally located. So you have an inability to access healthcare, you have an inability to access education, you have an inability to access jobs. And the map I showed earlier that showed, high poverty and low vehicle access, that was work we did on a job access study. And we tested that theory, and we showed that, by increasing transit in the community, folks in those areas of high poverty and low vehicle access, on average, they would be able to access somewhere in the neighborhood of 150,000 extra jobs, right? So, finding the job that's right for them, finding that career pathway that, will propel that family, to a more prosperous future.
Thanks.
One thing I would jump into, I think a really important aspect that, I think sometimes gets overlooked is figuring out how we can work to remove obstacles that lead to individuals working toward their own success. There's been multiple times, and I think this pandemic has shown it time and time again, of resources that are available, and understanding that the availability of resources in the way that I perceive availability is not sufficient to actually improve our communities. Some examples of this, for example, are, the PPP loans that came out in the beginning. There was a lot of conversations of people saying that the PPP loans were inequitably being used by non-people of color, mostly white individuals. And I've had conversations with very well-meaning individuals being like, well, what are you going to do? Like, I guess other people don't use these things. And that's obviously not the case, right? So let's dig a little deeper into each and every one of these issues and say, well, what is the difficulties in accessing these benefits that are out there for our communities? I think in reducing equity, it isn't just providing services, but actually like working through the process with individuals who are actually struggling. I'm very honest in understanding that I will not know, just as a white male, I will not know the same process as other individuals. And so figuring out how to go through that and understanding what are the obstacles is a very key piece that I think a lot of times individuals, overlook. I mean, going back to a lot of what Antonio had said, there's a lot of housing supports that are out there. And I know that, Florida has been like, oh man, it's just really tough to get out these housing support dollars. Well, that's, again, there's a lot of conversations about, well, how are we presenting this information? How are we collecting this information? How are we allowing individuals to be able to access and receive these benefits? And so I think that's, but only, and also I would echo everything that Antonio and David also said, but I think that's a piece that sometimes we miss out on, is that, we claim that there are resources available for everyone when that's just not necessarily the case. And I think we do have to be a lot more critical of our own communities, of our own projects, of our own selves, and use that critical thinking to help move us forward to address these equity issues.
Thank you. So the next question I want to ask, not only of the three of you, but also of our participants today, as you've been listening to the gentleman present and now discuss, what are you working on already? Audience or participants, if you can type into the chat, I think this is a great opportunity for us to know about what is going on already. And then also looking at, you talked about barriers, Doug. I think not just the barriers on the individual level, but what are the barriers for this work that is already happening? What's in motion, so that I think we, as the folks that are on this webinar right now, how can we support and continue to move these things forward?
Since I went last first, I'll take it upon myself to go first.
So right
and also use it as a 1-2 punch, because I saw in the question and answer, Dave Rogoff had a question about what's United Way doing, and so I'll answer that at the same time.
Excellent.
And so I think, one thing that United Way has been, we've been doing, boy, oh, have we been doing things, but a few examples of some things we've been doing are going back to reducing the barriers to access to services that are available to individuals. A lot of it is actually 2 examples of the economic impact payment and the advanced child tax credit. That advanced child tax credit that's coming to individuals 1 week from when this has been recorded. So July 15th is when the first payment's coming out. We're figuring out that those are quote unquote automatic payments, but aren't necessarily as automatic as the word automatic seems, right? We find that a lot of individuals that have not filed their taxes, that do not have addresses, that had taxes prepared by individuals other than themselves, and so there's a different address available, aren't receiving these services and these monies that are a lot of money to help people get support and services. And so one way we're addressing these barriers is targeting specific areas where we have what we call it VITA, a volunteer income tax assistance program, a free tax preparation programs that we have throughout our communities. And we have some year-round sites that are available. One in Tampa, in Hillsborough, is in the Sulphur Springs neighborhood, so a low-income area. We have one in South St. Pete, and we have one in Sarasota as well that do year-round taxes to help people get not only their taxes prepared, but also benefits and access to these services to help remove obstacles. Because again, trying to figure out not just do we have supports, because there are some supports that are out there, but how do we help individuals get to those levels of support and get to those levels of access? We also have plenty of other programs that we are running, all available on our website that you can look through, so that I'm not spending the next 20 minutes just regaling stories of United Way. But there's also, just in the comments real quick, talking about needing bank accounts to receive payments. That's very important. And United Way Suncoast actually has a program called Bank On that works with banks and credit unions to have safe and affordable bank accounts that people can open online so that they can access benefits quickly and effectively. And also those accounts are beneficial especially for low to moderate income individuals. Things like not having non-sufficient fund fees. You know, you always hear the story of someone paying a check, that check bouncing, and they wanted to pay $5 for something, and now they have a $20 fee on top of that, right? These are accounts that don't have those services. And so again, available at our website, www.unitedwaysuncoast.org. You can find information about our VITA programs, our bank on services, as well as a lot of our COVID relief supports. This ends the plug for United Way.
So Doug, I would just ask kind of the second part of that question. What are the barriers that you might be running into with getting those out? You talked about the barriers of the individuals maybe, but how can I suppose the participants, other than just general knowledge, is there anything that we can do to support that work?
Yes, and so reinsert plug for United Way. I mean, a lot of the individual problems we were talking about, I think, have systemic counterpoints. And I think, to be very clear, that we're talking about an individual struggle. It's very rarely that individual that's causing the struggle, but the systemic obstacles that are just time and time again coming on them. And so I think a big conversation there is, how do we address a both and? How do we address systemic issues while simultaneously working on individual levels? An example of this is we're working actually at the state level to get some eviction supports better redefined in the state legislature, helping bring out, supportive services and mediation services, as well as some protections for individuals who may have been evicted, especially because of, COVID and things like that. But that stuff takes time, right? That stuff takes multiple years to build out that legislation. So it has to be a both and. We have to be doing these things at a systemic level while also talking with the information that we have at the county level about how do we redefine our own programs and services, and then going that to a neighborhood level. We have fantastic neighborhoods resource centers here in Hillsborough and Pinellas, in Sulphur Springs, Campbell Park, and North Greenwood, with fantastic staff that are there on the ground, helping individuals with specific needs and resources. And so it really has to happen at every single level to be successful.
Thank you. Dave, Antonio?
Well, I guess I'll follow the reverse pattern. So some of the things the partnership does, as an organization, the partnership is a privately funded business-led group. It's uncommon leadership for the common good. And we, focus on understanding what the issues are. And a lot of those issues are, laid very transparent through the regional competitiveness report. So we are ardent supporters of increased, transit availability, not just the shiny objects like trains or monorails or helicopters or whatever they have coming next, but just your regular old city bus, right? That's the workhorse that moves people around. Through our workforce efforts and an organization called Tampa Bay Works that we spun out, we're working to connect, through community-based organizations, the residents that have been, left out of a lot of careers, that there is a very urgent need from employers, to connect them with those opportunities, and at the same time align the ability of training providers, whether that is a quick boot camp or a certificate, maybe progressing into a degree for those individuals to become more prosperous in their career pathway. So that's some of the stuff we're doing, but just these problems are huge, and they're bigger than any one organization or one person can solve. And collaboration is what's needed, but collaboration is hard, right? Because you have very urgent needs, with the people and the citizens and residents you serve every day. And so when you have urgency, sometimes the important work of collaboration gets squeezed to the side. But you got to keep your eye on it. And I'm often reminded in the work that I do, and I imagine some of the participants do, and I know my colleagues on the panel here do as well. I'm reminded of the proverb, if you want to go fast, go alone. If you want to go far, go together. And we need to go far because there's a long way we need to go. So I feel like I should have plugged my organization more. You know, that would have been the best way to follow Doug, but go ahead. Antonio.
Yes. So one of the things I'll say really quickly, although THHI is a 501c3 not-for-profit organization, we are a funder. So we're the umbrella organization. So we actually fund a lot of the other nonprofit entities that are providing services. However, as I mentioned earlier, our job is to design the strategic plan with the community's input. And so the 560 and 560 strategy, we've been able to accomplish the goal of housing 560 people within those 560 days. We actually exceeded that. But the piece that we are continuing to drive home within the plan is actually accomplishing the individual deliverables with the different initiatives that are included. And so the plan is on our website, thhi.org. And so that's why I didn't present anything about the plan in general. But one of the things you would notice in the community's plan is that we're not just addressing the issue of homelessness, but we're addressing the causes of homelessness. And so it's not just speaking to housing, but it's also speaking to those barriers. We have something that is very innovative in there, seal and expungement clinics that we partner with the state's attorney's office to help people get eligible charges and or records sealed and expunged. We have an initiative called speed leasing, and that's basically just like speed dating, where we pair landlords and property owners with the agencies and their clients to make it easier for them to get access and identify appropriate housing needs, all the way to one that is called Operation Reveille, as you mentioned, where that is basically a housing surge event where a veteran can be experiencing homelessness on the street and within a day can have access to a unit with the key in their hand, fully furnished apartment and things like that. And so we try to bring on community resources to make sure that we can meet the gap of the community as a whole. We don't fundraise because, again, we don't like to compete against the agencies that we're funding. But one of the things we do is that we tell every community stakeholder and citizen, do not give to panhandlers, period, the end. If you see somebody on the side of the streets, if you see somebody sitting on the stoop at the store, they catch you going into Whole Foods, do not give them money because those dollars aren't going to actually help them get off the streets. If you perceive them to be homeless, most of them aren't. Most individuals experiencing homeless don't panhandle. But if you give to them, then you're not giving to the cause, you're not giving to the solution. And so be a part of the solution. You can give directly to our organization. 100% of the donations that come to our organization go back out to the community to support not only the initiatives as the initiatives are part of the strategic plan, but the individual agencies that we fund. For example, an agency may have a need where they say, the clients that we're housing tend to have a need for food. And so those resources that have come into our organization, we may put some of that money towards that agency in order to provide food for that particular family. But we also use community coordination and collaboration. Doug talked about how individuals that want to, work in their silo, they have this idea that, oh, we can do really great work. It's the difference between outputs and outcomes. And so an output is one thing, when we served 1,000 meals. Unless you're a meal site, that's just an output. That doesn't really do anything. But when you're talking about outcomes, you're talking about increased income. You're talking about access to permanent housing, whether it's through a voucher or through a temporary support organization. We're talking about increasing their employability, getting them access to jobs, such as like the Second Chance Job Fair that's part of the strategy. And so I could talk forever about what we're doing, but the key point I just really want to hit home is that give to, if you're not giving through the continuum of care entity, THHI, give to the individual agencies that are providing services to people that are living on the streets. Do not give to those that are that are given, do not give to those that are panhandling. That is a business. That's not a charity type of thing. That's a business. And so I'll yield.
Thank you so much. Unfortunately, we are at 1:29, and I think as I've seen some of the questions come in, I wish that we had more time, but I encourage you to communicate with these gentlemen, and I can certainly pass on questions as well. I know everyone has my contact information. So thank you, Dave, Doug, and Antonio, not only for your incredible presentations today, but for what you do for our community. It is a heavy, heavy lift. And I also want to thank Baycare for their generous support in the supporting these webinars. So next week, I will be sending the recordings, the resources, and resources, and PDFs of today's presentation to everyone that has registered. Those of you that are here today, and your friends that will look at them later. Everybody who registered will receive all of the documentation. And so I want to encourage everyone, if you haven't signed up already for our next session, it will be the 5th in this series, and it will take place on August 13th, same time, noon to 1:30. The role of trauma and systemic racism in health outcomes. And the great news is that we have expanded our capacity for live attendees, and we'd like to encourage participation a little bit more like we did today, so that we can really get the ball moving and learn from each other as well. After we close out, you'll see the survey come up. Please give us your feedback in the survey, and the survey will also come out with the materials and recording for today's webinar. Again, thank you all so very, very much, and have a wonderful weekend. I look forward to working with y'all again.
My pleasure. Thank you, Allison. Thank you.